this next segment is going to be on constipation. So it's another digestive disorder. Constipation doesn't tend to be nearly as much a medical emergency as diarrhea, and very much not as much a medical emergency as diarrhea and vomiting, which is a real consideration. But that said, constipation is frequent. It has multiple causes, and it's a problem that many herbalists can learn to help people with. So we'll talk about it. The one thing to know about constipation offhand, though, is some of the herbs to treat constipation themselves can create a lot of cramping pain. So I want to focus on that when we get to it. So some of the same things I've talked about with diarrhea and separating your diarrhea are true with constipation. And the first part of that is the constipation acute or is the constipation chronic? So generally, when I work with people, it could be somewhere in between. So acute constipation means it almost never happens, and now they're constipated. Chronic constipation means somebody says, I just get constipated all the time, and yet, again, I am constipated. So now it's time to define constipation. Constipations are infrequent bowel movements, and there is no number that does justice to how often people should have a bowel movement a day. So there's this idea of a norm, and the norm is something like one bowel movement a day. But that is, lots of people have more or less. So I would say something like 3 or so bowel movements a day to 1 every other day is very normal. 3 a day to 1 every other day. That's the question is not is it normal or abnormal? It's how do you feel? So if you have a bowel movement every 2 days, then every day, and then every 3 days, but you feel healthy and there's no subjective problem with your bowels, then you don't have any problem, right? It's not a matter of somebody saying numbers that affect you. So 3 a day to 1 every other day is common, but if you have more than that or a little less than that and you feel healthy, then I wouldn't apply the word constipation. I would just say that's your body type. Constipation is also something to consider working with preventatively. So a lot of people who have chronic constipation who know they're going into first aid events, including practitioners coming into these things, there's a few steps you can take to try to avoid constipation in these circumstances. Many things cause constipation. So in some of the circumstances that I work in, one of the main things that causes constipation is psychological stress, or just stress. Stress is generally psychological stress. Being in a new place, being around new people, and here's a big one. Many people are comfortable only in having bowel movements in bathrooms that they're familiar with. So often, the bathroom at their home. So a lot of people, when they travel, just don't like to have bowel movements other places, and so they start to hold back. So that itself could lead to constipation, right? So you're traveling someplace and you're traveling cross country and you're stopping at gas stations and you don't like to have bowel movements in gas stations. Now, you also, you have constipation from that. So that's not so easy to address. It's not an herb problem, right? I'm not sure how you would work with it. The person needs to learn how to relax, working with them, counseling them to have bowel movements in unfamiliar places. But this is really common. When I work at the Rainbow Gathering, so this is not a really common thing to happen, but I'm going to talk about it because it's something I see regularly, is at the Rainbow Gathering, we have slit trenches to have bowel movements. So a slit trench is basically, you get shovels and you just dig something about this wide and about this deep, so like maybe 4 feet deep and this wide, and what you're going to do is squat on this and have a bowel movement. So that's called a slit trench. So slit trenches carry a couple of problems. So I don't want to spend a lot of time here. This is not going to be common for many of you. The first one is many people are not used to squatting while having a bowel movement. I'm going to talk about squatting in a little bit. So the first problem is how to have a bowel movement without a toilet seat. The second one sometimes even more important to people, is that they're not used to having bowel movements in front of other people. So sometimes there are slit trenches or areas that are walled off so people can't come in, but it's not, outdoors. There's no door to the bathroom. And so for some people, they just can't have bowel movements because they're just really nervous about other people coming into them. It seems reasonable. Most of us have bowel movements in private, at least in the United States. Other places, it's often places where other people are around. So in that situation, what I would suggest is that they have bowel movements at times when other people don't go to the bathroom, which really tends to mean early in the morning. So, at a gathering like that at like 5, 6, 7 in the morning, it sounds odd. It's not a common situation, but I am suggesting what I suggest, which is see if you can find a place to have it. The reason you just can't build your own toilet, your own bathroom, your own trench willy-nilly is because we're trying to protect water supplies. You have to be conscious where you put your feces into the ground because it's contaminated if it's all over the place. So that's a whole other issue. But the answer to that is trying to find a place where you're relaxed and by yourself. So the point, though, I guess, is that there's a lot of psychological reasons for constipation. Stress and anxiety, depression also a lot of people will cause constipation as well. Disruption in travel, but also food. Different foods will create constipation. So there's many reasons for people to get constipated. It's not usually an infectious organism, but they can also be constipated from things like irritable bowel syndrome, where at some of the time you have diarrhea, and then some of the time you're constipated. If you have regular constipation, though, it makes sense to find a healthcare practitioner and discuss it and try to figure out what are the causes of the constipation. So I'm going to shorten this up by jumping to treatment of constipation, but understanding that there's much more to study and understand why people can't have bowel movements and the treatments to them. In the United States, by the way, one of the main reasons for constipation is a low-fiber diet. So this is not a first aid event, but increasing people's fiber, if you know they have a low-fiber diet, increasing fiber can definitely help people. I mean, I see it all the time and suggest it, but that's not so much in first aid. In first aid, the most common reason for constipation is in an unfamiliar situation or eating foods that are causing inflammation or distress or having exacerbations of existing conditions such as inflammatory bowel disease or irritable bowel syndrome. So unfamiliar foods, unfamiliar places. So I'm going to move on to treatments for constipation. And I want to talk about a continuum here for constipation. And that's basically, when we talk about plants, here's my diarrhea. When we talk about plants for constipation, you basically have on this end very gentle laxatives, to more moderate laxatives, to what are called cathartic laxatives. Gentle laxatives generally mean they're not going to cause cramping, right? So a gentle laxative, a classic one I'll discuss a little bit, is something like yellow dock. So in the gentle laxative category, we're basically talking about plants that are reasonably safe to take, usually no matter how much you take. Moderate is just a little bit stronger, but here's the important ones. These are called, on the end here, and I'm going to put herbs into these categories. In the end here, you have cathartic laxatives. In first aid, they're really kind of your last choice laxative. And the cathartic laxatives include things like senna. That's one of the main ones. But even something in here like Cascara sagrada, which kind of falls in between these two. Cascara sagrada, which is Rhamnus persiana. The reason I'm mentioning cathartic laxatives is that they can work really well, but the problem with them is they can cause really bad cramps. What they're going to do is increase peristalsis. Peristalsis is that wave-like contraction that pushing, that coordinated pushing of moving feces through your body, moving feces through your GI tract, your lower GI tract. So you can poop. And so you want to take something that will get stuff moving through you. So you have a realm of gentle laxatives and moderate laxatives and cathartic. Laxatives, by the way, just means substances that help promote bowel movements. The cathartic laxatives can work really well, but if you take too much of them, for some people, they will create tremendous cramping. So basically, you're going to be bent over. You might actually have a bowel movement eventually, but it's going to be very, very painful. So when we start to get over into this realm, the cathartic laxatives like senna and cascara sagrada, you have to be considerate how much you're going to give them. So I'm not going to cover this here, but I just want to say when you're giving strong laxatives, be cautious, knowing that you might cause bad cramping. Now, on the gentle laxative realm, we have yellow dock, which I mentioned with diarrhea. So yellow dock, which is Rumex crispus and Rumex obtusifolius. There's other yellow docks too, by the way. If the person is coming to a situation and they know that they get constipated easy, one of the considerations is to start taking these gentle laxatives a week before they start traveling. So starting to take yellow dock before they go on the road. They can take it as tea or tincture, both works. Usually people are going to take it as tincture just because of the flavor. And so the dosage is something like a half drop or full. Really, it's so variable. Please understand that when I give doses, that it's just dosages, that it's just widely variable to people. And I give a number because it seems helpful, but you're going to have to figure out your own numbers, more or less, more frequent, less frequent. But they can start taking yellow dock like a half dropper full twice a day for like 4 or 5 days before they travel, and then just keeping that up. And for some people, it will tone their GI tract and just allow them to have better bowel movements. Just to make sure I cover this category right now, if it is due to stress and change in travel, a huge category, before we come back to the laxatives, are your nervines. If you know that stress and you're going to freak out and you're going someplace and you get nervous and that causes constipation, think about all of the plants that can help you reduce your stress and anxiety, depression. So just whatever plants work for you, whether it's kava kava, a glass of wine, damiana, what else? We've skullcap, hops. So if you know that your constipation is very much tied in, this is common in first aid with stress, it's not so much laxatives often. I'm going to come back to these laxatives. It's often herbs that relax your body in general, and then specifically because, as I've mentioned, your intestinal tract is just wired with nervous tissue. It's just relaxing your whole body. That will help relax your GI tract and might help you poop better. So if that's not working and you want to help move the feces out of you, you have laxatives. You can start gently with Rumex crispus. The moderate laxatives is actually a cousin of Rumex crispus, and that's called Turkey rhubarb. It's also a relative of the food called rhubarb. It's the roots of the rhubarb, of the Turkey rhubarb, but it's a bunch of species, so I'm going to stick it up here. But the genus of it, because that's usually how you find it, is rheum, as in rheumatic. So rheum species are your moderate laxatives. And by moderate laxatives, I mean they are stronger than yellow dock, but not as strong as senna. But also, it's a good, you move stepwise fashion. So you start with your gentle laxatives, they don't work, you move towards your moderate laxatives. And if they don't work, then you move towards your stronger ones like Rhamnus persiana, Cascara sagrada, or senna. I'm not going to give dosages for these plants here. I suggest looking them up and getting a fuller understanding, because you can do harm if you take too much. So what I can say without giving a specific dosage is to start with really small doses, right? Start with really small dosages, 1 or 2 drops of the tincture in some water. And now I want to talk about, so without specific dosaging, the best time to take a laxative is right before you go to sleep. So the Nervines, what I said, if it's just your nervous struggles and taking them and taking hops relaxes you when you have a bowel movement, it doesn't matter when you take those. That's kind of up to when you feel stress. For the laxatives, it does matter. The best time to take laxatives, any of them, yellow dock, turkey rhubarb, cascara sagrada, or senna, is right before you go to sleep. So you're going to visit relatives. This is kind of a first aid situation. And you get pretty uptight in this situation, so you're taking your Nervines, but you still can't poop. And you're going to be there for a couple of days. Maybe before you go to sleep, take, a glass of water and add a half dropper full of yellow dock. Where that hasn't worked, add a couple of drops of turkey rhubarb and take it before you go to sleep, or even these. The reason is you go into a parasympathetic mode when you're sleeping. When you're sleeping, that's when your body's most relaxed. And the herbs, these laxatives, work best during that time. How they often work, how you hope they work, is that when you wake up in the morning, what sometimes happens for people is they wake up a little earlier than normal and have a bowel movement. So they might wake up at 4 or 5 to have their bowel movement. It's just one of the ways that it works. If you give too much, by the way, of these two, what will happen is they'll wake up at 2 or 3 in the morning with really bad cramps. If they have really bad cramps, I want to recommend a remedy, another herbal remedy, to give them. So if you're going to give senna or cascara sagrada, and they do get cramps, if you have a bottle of wild yam tincture, so I talked about wild yam as a gut antispasmodic, so it's helpful here, right? So if the person, you give it to them, and you're just worried for whatever reason that they're going to wake up with really bad cramps, so yellow dock hasn't worked, and turkey rhubarb hasn't worked, and they've taken so many drops of senna, it hasn't worked. Now they're increasing their dosage because they just got to poop because it's day 5, and they're going crazy. What you can do is give it to them, have them take an increased dosage of the senna or cascara sagrada, or buckthorn is another one, by the way, Rhamnus frangula or Rhamnus cathartica. You have to learn how to use those two. I'm just learning how to use those, by the way. Those last two I've mentioned, the buckthorns, are close relatives of cascara sagrada that grow around here, and I'm hoping myself to learn how to use those. All right, so they take the senna or cascara sagrada, and somebody's read a bunch and now knows how to use the other buckthorns. And then if they wake up with cramps, they just immediately start taking the wild yam to try to subdue the cramps that have happened. It might also, by the way, impinge their bowel movement, but the cramps are worse. Usually by the time they start cramping, because what you're doing is you're instigating a peristaltic response. So this is kind of the quick and dirty of constipation in first aid events. Many, many forms of constipation, like food habits cause constipation, different essential fatty oil deficiencies create constipation. Different body types are more prone to constipation, but this is really about first aid and constipation. So I would suggest, if you're going to work in a situation for a couple of days and people are going to be staying there and might be constipated, to bring these, at least 3 of these medicines. The ones that I regularly bring are yellow dock tincture, turkey rhubarb tincture. Actually, I don't always bring yellow dock, honestly. First, I can find it, and if it's that gentle a laxative, it is one herb I might not carry because I'm working for stronger medicines. But I will have turkey rhubarb and cascara sagrada, because I gather cascara sagrada. And I'll start with the turkey rhubarb to initially see if I can get the person to have a bowel movement, and then move to the cascara sagrada, hopefully not creating any cramps. So there's many other ways to treat constipation that are about chronic constipation. But I hope that you have a sense of a couple of herbs you can use in first aid for kind of an acute constipation in these situations. So Nervines and laxatives are 2 of the mainstays. Using gut antispasmodics in case there is, in case they do get cramps. There are other remedies for constipation, but for the first aid predicaments, these are the ones I recommend getting to know for now. So good luck.